Let me ask you something honest. When your knees hurt, when your ankles feel stiff, when your legs feel weak or shaky, what's the first thing most people do? They reach for a pill. Maybe it's Advil. Maybe it's ibuprofen. Maybe it's something stronger the doctor gave them. And then they're told the second piece of advice that sounds very wise but quietly makes everything worse. Just rest more. Now here's the uncomfortable truth. You can swallow painkillers all day. You can lie in bed 20 hours a day. But if your body is missing two specific nutrients, your joints will keep hurting. And your legs will keep getting weaker. And today, I'm going to show you exactly why. Because what I'm about to tell you might completely change how you think about aging, pain, and weakness. You see, most seniors believe this story. Of course my legs are weak, I'm getting older. Of course my knees hurt, that's just life. But what if that story is wrong? What if weak legs and joint pain are not normal aging? But warning signs. What if your body isn't wearing out, but slowly starving for the materials it needs to repair itself? And what if the very pills you're using to cope are quietly making the problem worse? Here's the part nobody tells you. Painkillers don't heal anything. They don't fix joints. They don't strengthen muscles. They don't rebuild cartilage. They don't improve balance. They just mute the alarm. And while that alarm is muted, the fire keeps spreading. Worse, long-term use of these drugs is linked to higher risk of heart attack and stroke, kidney damage, stomach bleeding, digestive problems, higher blood pressure, and faster physical decline. So today I want to show you a smarter, safer, more logical approach. I'll show you 2 nutrients that attack the root cause of joint pain and weak legs, and 2 very common pills that quietly sabotage your recovery. And stay with me because near the end, I'll tell you the breakfast mistake that's draining strength from millions of seniors every morning without them realizing it. Let's start with something most people misunderstand. Joint pain is not just wear and tear. Most people hear the word arthritis and imagine rusty hinges. But in real life, a huge amount of joint pain is driven by inflammation. Not just in the joint, in the whole body. Your immune system gets irritated. Your gut gets damaged. Your tissues stay in a constant low-grade fire. And your joints and legs pay the price. That's why pain often comes with swelling, stiffness, morning pain, fatigue, weakness, and that heavy, old feeling in the legs. Now here where painkillers fool people. They block pain signals for a few hours. You feel better. But inside your body, the inflammation is still burning. In fact, in many cases, it's getting worse. Because frequent use of NSAIDs like ibuprofen and naproxen damages your gut lining. And your gut is not just for digestion. It controls your immune system. It controls inflammation. It controls how well you absorb nutrients. When the gut is damaged, it becomes leaky. And when that happens, inflammatory compounds spill into your bloodstream and travel straight to your joints, your muscles, your bones. So now you're stuck in a cruel loop. Pain right arrow, pill right arrow, gut damage right arrow, more inflammation right arrow, more pain right arrow, more pills. And slowly, quietly, your legs get weaker. So what's the smarter solution? You don't just silence inflammation. You teach the body to resolve it. And that brings us to nutrient number 1. Number 1, omega-3 fish oil. If joint pain and weak legs had a natural enemy, this would be near the top of the list. Omega-3s don't just block pain. They change how your body behaves at the cellular level. They reduce the production of inflammatory chemicals and increase the production of compounds called resolvins. Resolvins don't just calm inflammation. They actively clean it up. Fish oil contains 2 powerful omega-3s. EPA, DHA. These get built into your cell membranes and make your tissues less reactive, less swollen, less angry. And for seniors, the benefits go far beyond joints. Omega-3s help maintain bone density, improve calcium handling, support muscle protein synthesis, improve balance, support heart and brain health. In simple words, they help your body hold on to strength. They help your legs stay useful. They help you stay independent. And yes, they reduce joint stiffness and pain. Now you can get omega-3s from food. Here are 3 easy, realistic options. Simple grilled salmon with lemon, garlic, and herbs. Mackerel salad with cucumber, tomatoes, olive oil, and lemon. Sardine toast with a little yogurt, mustard, and avocado. Nothing fancy, nothing extreme, just food your joints understand. But here's the problem. Even if you take omega-3s, even if you eat them regularly, if your gut is damaged, you won't absorb them properly. And this is where most people get stuck. Which brings us to the missing piece. The second nutrient, collagen. Collagen is not trendy. It's not exciting. But it is foundational. It's what your body uses to build cartilage, tendons, ligaments, bones, skin, and even muscle tissue. But here's the part most people don't realize. Collagen also helps repair the gut lining. And if your gut is damaged from years of stress, poor diet, or painkillers, your body is leaking inflammation into itself. Collagen contains amino acids like glycine, proline, glutamine. These help seal and repair that gut lining, so fewer inflammatory signals get into your blood. Which means less joint pain, less stiffness, better absorption of nutrients, better response to omega-3s, and better recovery overall. But that's not all. Collagen also provides the raw material your body needs to rebuild cartilage, strengthen connective tissue, support muscle maintenance. Studies have shown that seniors who supplement with collagen for just a few months can see less joint pain, better mobility, more muscle mass, better strength. Not miracles, but real practical improvement. You can get collagen from bone broth, long-simmered soups, chicken feet soup, gelatin-rich stews, old-fashioned foods, the kind our grandparents ate without thinking. Now here's the uncomfortable part. You can do everything right. But if you keep taking the next 2 things, you're fighting uphill. Pill number 1 to stop abusing, antibiotics. Let me be very clear. Antibiotics save lives. If you have a serious bacterial infection, you need them. But overuse is quietly destroying senior health. Every round of antibiotics wipes out good bacteria, vitamin K2 production, inflammation control, nutrient absorption. Your gut bacteria help direct calcium into bones instead of arteries. They help control inflammation. They help you absorb magnesium, vitamin D, omega-3s, and more. When they're gone, bones weaken, muscles shrink, inflammation rises, and recovery becomes harder and harder. This doesn't happen in a week. It happens slowly. And one day you wake up and think, why do my legs feel so weak? This is one of the reasons. Pill number 2, daily NSAIDs. Ibuprofen, naproxen, aspirin, occasionally fine. Daily for months or years. That's where the damage starts. These drugs destroy your gut lining, increase intestinal permeability, increase systemic inflammation, block cartilage repair, reduce blood flow to muscles. So you get thinner cartilage, weaker muscles, slower healing, higher fracture risk, worse balance, and ironically, more pain. They don't just fail to fix the problem. They slowly build a bigger one. The real strategy. You don't heal aging legs with pain suppression. You heal them by reducing inflammation, repairing the gut, feeding the tissues, and supporting muscle and bone rebuilding. Omega-3s help calm the fire. Collagen helps rebuild the structure. Together they attack the root. One final question. Which of these have you been relying on? Painkillers? Antibiotics? Both? Tell me in the comments, I read them. And one last thing. In the next video, I'm going to show you the number 1 breakfast mistake that quietly steals calcium from your bones and makes your legs weaker every single morning. Almost nobody suspects it. Almost everybody does it. And the fix takes 30 seconds. Make sure you're subscribed. Your legs depend on it.